Welcome to the online audience to this one-on-one interview with Mirka Cikkelova, the Secretary General of the European Patient Safety Foundation. Mirka, thank you so much for accepting this interview, and today we're going to be talking about some of the aspects surrounding the implementation and the introduction of digital health technologies in the clinical pathways. So I would like to start off by asking you, what are the three factors that you think from a patient safety perspective that are currently missing in the debate around the implementation of digital technologies?
Thank you very much, first of all, for the opportunity to be part of this discussion. And from our perspective, so European Patient Safety Foundation is bringing together different stakeholders, and then we try to listen and understand their needs. And then we translate it into our actions. And from our point of view, when listening to our affiliates and to our members, we think that there are three things that are, from our point of view, is missing. One of them will be healthcare worker well-being and safety. Mm-hmm. That will be definitely the first that is not being mentioned when we talk about the new technologies, mm-hmm. because we stop or we don't think about the people, in which conditions these people are now when we ask them to bring new technologies to their everyday working life. Mm-hmm. If we have a staff that is fatigued, has a chronic fatigue, and there are research that confirms the levels of burnout, mm-hmm. and we ask them to implement new technologies and to work with new technologies, we need to keep in mind that they already work in hard conditions, mm-hmm. and with bringing in technology, they need to think about their work processes. They need to change that, mm-hmm. and that's really difficult when you don't have time. Mm-hmm. So one of them will be, let's be realistic and think about the real life of these people who will need to work with the technologies. Mm-hmm. So that will be one. Second one that is being kind of omitted and missed is when we do the implementation. So implementation and then preparing the front lines again, mm-hmm. for having the new technology, we need to put in place processes that will also ensure that we receive a feedback. Is this technology really useful? Mm-hmm. Are there some problems that are linked with the technology? Are there new problems that are created by the technology? And for that, we need to ensure that there is a good atmosphere and psychological safety of those using them again. So that would be a second point. Mm-hmm. And of course, not the last, because this one should be the first one. We think as a technology, or we see a technology as a goal. Mm-hmm. It's not a goal. The goal is improvement of patient safety and the outcomes. And the technology is a tool. Mm-hmm. And we need to keep in mind that first we need to define the priorities, mm-hmm. what we want to achieve, how we want to change the system, what we want to improve from the patient safety perspective, and then search for the solution, technological solution. And that's great. Like in this environment, and now what is happening, we have the solution for almost any type of thing we want to change, and we can use them, but let's keep the focus and kind of switch from the short term fixing the problems to long term what we want to achieve. Mm-hmm.
So if I can briefly summarize this, the first point that you mentioned is we need to recognize that health professionals are fatigued already, and the implementation of these new technologies, in order to realize on their alleged benefits of reducing fatigue, it will likely require a period where they might be more fatigued to get used to these new technologies. Is that correct?
Well, we need to allocate time. We need to understand that they don't have enough time, and if we want to implement them properly, we need to think that they need time,
right,
for training, for implementation, for getting feedback, and only then we will use the potential of these technologies.
Right, thank you. And then the second point was to create a psychological environment where it is safe to give feedback as honest as possible. Did I understand that correctly?
Yes, exactly. With new technologies, there is a high risk, especially if we go quickly with the implementation, that they will create new problems. And if we have the field or in the professionals teams that are not used to speak about problems, they will just find their new workaround, and we will not intentionally, but cause probably a new harm to the patients.
Mm-hmm. And then the final point that you mentioned was to be realistic about what these new tools are. They're not the silver bullet that will solve our health systems, but they are potentially a powerful tool to address some of the issues that are plaguing our health systems. Is that correct?
Yes, so they have a huge potential, and we need to use this potential, but we need to be clever about understanding how this potential will be achieved.
All right, thank you very much. Then moving on to the next question. So for the second question, I would like to follow up on this idea that digital technologies bring immense potential to the health system. This kind of almost this promise has resulted in tremendous investments amounting to upwards of 500 million euros up until now into these new technologies. But the payoff of those investments have been difficult to realize. Why do you think that is?
Well, first of all, I would be really interested, and I don't have the data, I don't know the exact amount, how much of this investment, which part of this investment was going into training and then implementation of these new technologies. Maybe you have the...
So I don't have the exact percentages, but looking at the grants that have been issued, the majority of these investments have gone into the development of new technologies, with only a marginal part of those being allocated to upskilling and training opportunities.
And this is, from my point of view and from our stakeholders, from our affiliates' point of view, this is one of the key issues and the key problems, because the technology is, I will not say useless, but the potential, and it is frustrating also for the companies that are developing them. It is a huge frustration because they have, the technology has the potential to make changes and to bring them, but we will not achieve that if we don't provide training that goes with these technologies, and if we don't implement them properly. And for the implementation, as said before, you need to think about the real life and where the healthcare professionals are at this level of shortages and burnout, and they need help with the implementation. It's a huge project management that we need to ensure that in the hospitals, if we want to implement the technology properly. And for that, we need to think about the time that they will need to investigate for redesigning their workflows, and then for preparing themselves to maybe start using the technology so that we can, adapt. You have these waiting times, and patients, they need to be treated at the same time. We can't just simply switch to another technology and stop, treating the patient. So we need to really bring more investment in the training and in implementation, proper implementation of the technologies.
And when you say more investment into training and upskilling, this goes to both the structural investment into medical curricula, I would imagine, as well as more acute versions of upskilling for actually practicing physicians that need to do this kind of next to their job.
Yes, exactly. That we heard that during our session with European junior doctors, saying that during the curriculum they are not taught about using new technologies. There is no one who tells them how to use these super efficient monitors, and they have so many functions and so many possibilities that if you don't have time to learn how to work with them, then you are not able to use their potential.
All right, Mirka, thank you so much for your time and effort in this interview. Thank you for the audience online, and I hope you got some new insights from this interview.
Thank you very much.